Hey, welcome to this Metricom Explainer. Today, we're totally rethinking urban health and disease prevention.
We're going to show you why street cleaning isn't just basic municipal housekeeping, it's literal healthcare.
It's super easy to judge a street by its cover. But is it just about looks?
Visually, we just want zero litter, but the hidden reality is absolutely vital disease prevention.
Our first big hazard isn't the garbage itself, it's the disease-spreading pests the garbage attracts.
The fix isn't spraying chemicals everywhere. Real disease control starts with simple prevention, like securing bins.
Here's the core truth. Pest control without strict waste control, that's just a temporary, failing reaction.
Next up, blocked drains. Stagnant water creates a massive, street-level public health hazard right under us.
We combat this with smart, practical controls, like rapid post-storm cleaning and proactive digital reporting.
Overflowing bins aren't just an eyesore, guys. They quickly become highly dangerous microbial breeding hotspots.
So, the crucial fix is matching bin capacity with neighborhood density, plus enforcing daily cleaning schedules.
Then there's air quality. Airborne street dust is packed with heavy metals, tire wear, and pollutants. By using mechanical sweepers and street washing, we directly reduce that harmful pollution entering our lungs.
We also have to protect our frontline cleaners. They're exposed daily to biological waste and dust.
Because keeping the public safe should absolutely never come at the cost of our workers' safety.
So how do we manage all this? We need strict, proactive structural systems, not random reactions.
We literally need rigorous preventative timelines mapped out way before these problems ever become visible.
That means using risk-based zoning. We prioritize rapid inspections for vulnerable spots, like schools and hospitals.
Here's the digital opportunity. Connecting data turns manual cleaning into a powerful, proactive health management system.
The goal is actually incredibly simple. Find the hotspot, fix it, and ultimately prevent it entirely. Small, practical controls, applied consistently, prevent massive public health crises from ever starting in the first place.
Ultimately, a clean street isn't just a shiny surface. It's our daily, frontline public health barrier.
So look closely at your own neighborhood. How does your city measure up in protecting you today?